Hello, I'm Emma-Louise Coffey and you're welcome to the Dairy Edge, the Teagasc Dairy podcast. We're bringing you the latest information, insights and opinion to improve dairy farm performance. On this week's episode, Conor Hammersley shines a light on the culture of masculine identity that stops many farmers from seeking help and support with their farm businesses and mental health.
I suppose over the last decade or maybe a little longer, men's health in general has come under the microscope, I suppose, in Ireland, demonstrating much higher levels of adverse health outcomes relative to their female counterparts. And I suppose if you delve then a bit deeper into that data, you start to see subpopulations of men that are a bit more marginalised in relation to their health than others. And farmers are one particular group that have been highlighted, adversely in relation to health, and particularly around heart disease, cancers, and mental health, and often don't present with health concerns until issues have reached, a crisis point, and if they do present at all, and then I suppose coming back to our work with Teagasc and the National Centre for Men's Health was to look at kind of the socio-cultural environment within rural communities that can constrain rural men's and particularly farmers' adaptive capacity, to deal with some of the health challenges that they face in an appropriate manner.
And to get some more information from you, Conor, like you would have worked with a cohort of farmers to dive deep into, I suppose, the dynamics when you talk about the socio-cultural environment. Who exactly did you work with there?
We interviewed farmers. Yeah, we interviewed farmers from varying different farming enterprises, and then we also interviewed other close bodies that relate to farmers to try and get the broader contextual perspective of the cultural environment that farmers operated within. So we interviewed wives and / partners of farmers. We interviewed children of farmers too as well, and we interviewed agricultural advisors from different farming enterprise backgrounds as well. And then we also interviewed farming representative bodies such as the Irish Farmers Association and Macra na Firma, which gives a mandate for younger farmers to try and get as broad a perspective as we possibly could.
And what are the key findings, Conor?
So what we found was that farmers' commitment, to a particular masculine identity, which on the surface was kind of demonstrated through, projecting themselves as, strong men, suppressing emotions and help-seeking behavior, to avoid being seen as weak or vulnerable within their community. And often these things can then go, unaddressed and can fester under the surface and then, amplify over time. And then what we noted was that, this pursuit of this dominant kind of masculine image, within a farming context, can, greatly kind of get in the way of help-seeking behavior, particularly within rural communities, for the fear of being consigned to kind of a marginalized, masculine status in a local area. And previous studies have shown then that male farmers tend to equate health practices with femininity, and that help-seeking in particular can be seen as compromising, a farmer's allegiance to masculine norms, of independence and autonomy, that, they're able to, if any concerns that they have, they're able to just draw on their own skill set to deal with those issues. But unfortunately, that isn't borne out in reality and in national health statistics. So ultimately, what we note is that the act of opposing health-enhancing behaviours or help-seeking behaviour is seen as an active demonstration of manliness for some farmers, and a rejection of the more feminine connotations of weakness and stigmatization associated with health. So in essence, the cultural influences that shape farmers' beliefs, attitudes, and practices, are synonymous with a particular masculine identity, and ultimately demonstrated in the avoidance of behaviors that show concern, for health or that require emotional expression or help seeking, and ultimately based on such practices, positioning farmers as weak or vulnerable.
From a societal point of view, Conor, is there any way to break down that particular barrier?
Yeah, well, the first thing I'd note is that it's a cultural problem. So it needs like a cultural intervention, and culture is developed off, or cultural stigmas are developed when there's a vacuum of silence associated with something, and stigmas will occupy that space if something isn't addressed. So we want to try and encourage opening the conversation in relation to health and mental health. And a project that we're very interested in at the minute is the On Feirm Ground project that you may be familiar with, Emma-Louise. And what we're looking to do at the moment is the first phase of this is rolling it out with agricultural advisors. So we work very closely with the Men's Development Network down in Waterford. And this is, a cross-departmental project with the Department of Health and Department of Agriculture, and the Men's Development Network down in Waterford and their engaged training development team have come up with a lovely program that is going to train agricultural advisors to equip them, with the softer skills to be able to engage with farmers in relation to their health. And it's important to note not to be seen as like health professionals, but be able to open the conversation with farmers in relation to their health, including mental health, and try and be a bridge or a gap between the farmer and health services locally to try and, overcome and challenge some of them cultural barriers that farmers face in relation to their health. And the broader project is that training would be rolled out to other linking bodies with farmers, such as agri-banking, agri-business, veterinary occupations, even cooperative staff, that they would be able to recognise signs and symptoms of farmers in distress and be comfortable in opening the conversation in relation to health. So, and that's not to underestimate the complexity of it, because it is a tricky thing to engage with. But we just want to kind of empower, first, let's say, people who interact with farmers, like advisors, trying to build on that kind of close relationship that they may have with farmers, and then try and as a byproduct of that, try and empower farmers to be more proactive about their health.
And I totally hear you, Conor, when you say that it's very complex, and it's it's not just a farmer problem. It's an overall within the national population, it is a cultural problem. Looking to the individual, and while you talk about there is efforts to I suppose in a greater population, a greater society of farmers to work on it. As an individual, for somebody listening today, is there any particular way that you think they could work on themselves in order to break down the barriers of masculinity in themselves?
Yeah, well, the first thing I would say is the perspective side of things, and it's ultimately that there's just stigma around in relation to engaging with these things. And often we can think that, and maybe this stems from farmers working in isolation, and they might think that the problems that they're dealing with are isolated problems, that they're the only ones experiencing. But all these things are such natural and human things to be dealing with, and they're universal problems that many people face. And that, and I think perspective around that can maybe help people engage in that a bit more. And that, I mentioned kind of the cultural conformity nature in rural communities that is definitely there, but also a big strength or asset that is prevalent in rural communities is the support that's often there. And this is often demonstrated, in times of need within a rural community, maybe through, there might be a bereavement locally, and the community can really rally around each other. So the point that I'm making is that, these perceptions of that I can't open up about this for fear of what they'll think, isn't borne out in reality, because from my own experience from being in a rural community, rural communities are very good to support each other in times of need. So often these perceptions of an identity that they feel they need to live up to aren't borne out in reality, and people are always, very supportive if people are, particularly farmers or rural men, need support in relation to their health and specifically mental health. and just added to that, then I would say that it is good for, farmers to, just maybe twice a year, even if they're feeling good, their health is good, to just go to their GP and get a regular checkup, just to keep on top of things and make sure, there's nothing festering under the surface.
And it's really interesting that you say that, Conor, because we would have spoken with Ed Payne, a dairy farmer in Roscommon, and he would have talked about, he has gotten into running in a big way. And when he started running, he'd actually actively sit into the car and drive away from his locality because it would have been seen as he was skiving or he was lazy if he wasn't on the farm for the whole day. So it totally links into what you're saying.
Yeah, that's interesting. And again, so much of these are just social constructions that we have developed, and some of them are good and some of them are not so good. But one of the things that is not so good is this kind of cultural glorification of busyness, like that we have to be, busy, and for fear that people were thinking that we weren't busy or taking time out for ourselves, again, is kind of stigmatized or seen as like, not this hard working image, which is rubbish, like, and we need to expose those kind of behaviors as inherently unhealthy behaviors. And it's not to suggest that farmers shouldn't be resilient, because they do need to be resilient in some of the work that they do. But is when that kind of morphs into how they relate to health and help-seeking behavior, and even engaging in a simple thing like going for a run, or going for a walk, or taking time out, or going out for whatever, and even a meal midweek or whatever, that those things aren't seen as like failure or not of a kind of a hard working image that often rural men can try and present themselves as.
And looking then and moving on a little bit, Conor, every dairy farm is different, and the challenges or stresses that people experience on farms vary. What are the common stressors that the people you would have spoken to identified for their farms?
This kind of comes back to the contemporary nature of society, I suppose, at the minute, and the kind of changing nature of agriculture in many sense, particularly with the onset of agri-environmental regulation, prompted in particular by environmental concerns at a wider societal level, and more kind of paperwork and demonstrations of compliance associated with farming, I suppose, than it ever was before. And then also the market demands, and the farmer is kind of in the middle of all these things in this kind of tug of war going on. And that's kind of a unique stressor or a contemporary stressor for many farmers in adapting to these new measures associated with farming. And we contend that just more supports need to be put in place to help the farmer adapt in this changing environment from a practical sense, but also on a kind of an emotional sense and a mental sense, because many farmers had constructed their identity of this notion of associated with kind of productivist agricultural methods where maybe more was better. But now some of that is being contested with agri-environmental concerns, and often the productivist model and the environmental model can be at odds with each other, and the farmer is in the middle of that. And that's quite a unique contemporary stressor for farmers, particularly dairy farmers at the moment.
And to take that a step further, when you talk about new measures, all this additional paperwork and compliance and market demands that we're exposed to, this is also coupled with a huge level of expansion across a number of dairy farms in the last decade or so. And with that expansion, there has been a huge focus on building resilient farm businesses, and little or no focus on the farmer as an individual and their ability to cope with the, I suppose, additional challenges that they face. What do you see as the best ways to cope with challenges that do arise on dairy farms?
Yeah, well, the first point that I would make on it is that often those things, as you said, they can miss out or not take into account the ripple effects of these things for farmers. So in terms of expansion being promoted, and now the negative externalities that can be associated with expansion, agri-environmental concerns, are now being promoted. And what's often lost in that conversation is the ripple effects of how a farmer might adapt to those changes that are going on. Because, like anyone, if you construct your identity out of a particular way of doing things, and then we're saying that, we need to reshape this, in some instance, that can be quite a corrosive message, for the farmer. And we can lack that kind of conversation, or how, they can socially or culturally react to that. So from a policy perspective, more concerns or more kind of supports need to be put in place for farmers to adapt to that change within farming. And then, just for the farmer themselves, and this, a lot of this stuff interlinks together. But what I would note, and because I remember, chatting to a dairy farmer in relation to this, and he was talking about, the stress that he was under in relation to some of the things that we spoke about already. But then it came up, about help seeking, and he just found it, he confided in me that he just found it very hard to reach out for support in relation to some of these difficulties that he was experiencing from a practical sense, but also, in an emotional sense, when things were getting on top of him. And I remember the word, it was like a mission of failure, that I wasn't able to deal with these things myself. And what I would contend is, it's not giving up. Seeking help isn't giving up, or seeking support isn't giving up. It's actually the exact opposite. It's driving on, and it's willing to show that you want to, adapt to these things, both from a personal point of view and also from a professional point of view. So I think, in a broader sense, we need to culturally reshape how we view seeking help, so farmers can adapt to these change in nature of farmer in a more appropriate manner.
I think, around this conversation, you would have talked about On Feirm Ground as this new initiative. And there's also, other really, really good examples of the conversation being started in some discussion groups. And also, the recent Ag Mental Health Week, it is something that, asking for help and seeking out help is something that, in some instances is really being encouraged. And the services and the professionals that are there to help people, are widely advertised. And I guess, the first port of call is often the GP, but from a farming perspective, when you think about, an issue technically on farms, the agricultural advisor and the vet are really, really strong protocols that are always willing to help.
Yeah, most definitely. And again, a lot of these things that they can't do these things or open up all things, these things are perceptions. And, and again, I just go back to the point that it's not that you can be, as a farmer, you can be resilient in some contexts in regard to some of the work that you have to do, but not to try and let that fester into other aspects of your life, particularly when, if stress is getting on top of you, or if your health is compromised in some way. And I remember this being reflected kind of by a wife of a farmer when we were conducting the study too. And, she said that, my husband is the first one to always offer help and support, but the last one to seek it himself. And the thing is, for farmers, to extend that support and empathy that they can show for their livestock, their farm, their family, their community, and extend that support and care to themselves. Because ultimately, without the farmer's health and well-being, the farm itself is nothing without, a healthy and vibrant farmer.
Looking then to rural communities, how have things changed over the last number of decades as you see it from your research, Conor?
Yeah, so I suppose when we were conducting the study, grave concerns were expressed about, the unraveling of rural communities to some extent. And maybe that's even too strong of a word, but it would seem to be underpinned by, the decline in the number of viable farm holdings, particularly in more geographically isolated parts of Ireland, the closure of rural services and social outlets, and the loss of community spirit or mettle, that, this sense that, or this sense that farmers were even too busy to be even helping each other out, and which was a drift by more kind of communal efforts that were associated with farming, in a previous generation, and to some extent by a sense of being let down or abandoned by key pillars of society, and policies not taking into account the contemporary needs of rural areas. And this kind of increased the risk of isolation and loneliness and problems kind of festering over time. So those were the kind of the issues that were expressed among rural inhabitants who we researched, that were kind of compounding issues, or issues that compounded health and well-being within a rural community. And I think more supports need to be put in place to address kind of the contemporary needs of rural areas to support people within those communities.
And for the farmers themselves, Conor, if we think about it, as you say, traditionally, when you're harvesting, whether it's silage or hay, everyone on the road would be rowing in behind you to get the job done before weather breaks, maybe. That sort of thing doesn't happen anymore. Are we all too busy to get involved and give a helping hand?
Yeah, and I suppose this is kind of demonstrated it's not just demonstrated in farming communities, it can be demonstrated in many communities that we have so many kind of luxuries nowadays that, we don't need to kind of seek help or support in ways that we might have used to. For instance, you can contact each other very easily by the touch of a button on a phone nowadays. And also in a farming context, machinery has replaced physical labor as well. And the onset of that is probably, more kind of loneliness and isolation. And it's also perception that I can't ask, the farmer down the road for help because, he's too busy and, I'm busy and it would be unfair on me to be asking him for support. So those are kind of shifts that have happened in rural society that, I suppose, and it has helped, it's not that machinery or technology is all bad, but it's just kind of a knock-on effect that has kind of reduced social interaction that, can have a negative consequence on people's social life.
And Conor, you mentioned that On Feirm Ground is the next step in terms of your research, creating, I suppose, platforms and structures to provide more education to us on the softer skills around farming and life in general.
Yeah.
But I mean, to take a step back and maybe provide some initial tips or advice for farmers to, overcome barriers to protect their physical and mental health?
Well, I think, first of all, it's important to recognise the important work that farmers contribute to society in terms of providing food, nutrition and sustenance to a growing population, and the important work that does for society. Because every time we sit down at the table, I suppose broader society can be aloof to the work that has gone in to facilitate that meal in front of you. So I think broader society needs to appreciate the role of farmers, the role farmers play in society. And then just from, a practical perspective, I think the broader perspective in acknowledging that these challenges that they may be going through or facing, be that, with specific issues, it could be, different things within farming that's stressing them, succession, or as we talked about, the change in nature of farming in relation to subsidy payments and regulation. If any of those things are getting them down, that they're not struggling with that in isolation, I think is very important, that they're universal problems, and that seeking support for them would be a very, very wise thing to do. And there's there is plenty of support out there, if they can, if they can reach out for that support. And then, if they can try and give themselves, we spoke about, this glorification of always being busy and having to work, if you can just get over that rubbish and give yourself time on a daily basis, whatever that may be, a half an hour or an hour, to get away from the farm and for yourself, be that a walk or whatever it may be that you like to do that and give that time to yourself, I think is very important as well.
And I think one of my take-homes that I think everyone should look into, Conor, you mentioned that regular checkup with the GP. So in the last 6 months, if this is something that you haven't done as a farmer listening today, why not make the call and book in for that checkup? Thank you, Conor.
Thanks very much, Emma-Louise.
That's it for this week's episode of the Dairy Edge podcast. And my thanks to Conor Hammersley for joining me on this week's show. Don't forget to rate, review and subscribe to the podcast. You can listen on Apple and Google Podcasts as well as Spotify. And for more information, go to the Teagasc website at teagasc.ie. I'm Emma-Louise Coffey, and join me next time for your Dairy Edge.